Assalamualaikum and hi everyone. My name is Nur Ain binti Alias. My metric number is 081063.
My name is Nur Anis Ana binti Aziz. My metric number is 080672.
And my name, Nur Iman Umaira binti Muhammad Kamrul. My metric number 080199.
For this anatomy presentation, we want to present about our topic that is hip bursitis.
Bursa are small, jelly-like sacs positioned between bones and soft tissues around joints throughout the body. They act as cushions to help reduce friction but can become inflamed in a condition known as bursitis. Trochanteric bursitis can cause pain at the outside of the hip near the greater trochanter. When the bursa at this joint becomes irritated or inflamed, it causes pain in the hip that can extend into the iliotibial band.
I will start the definition of hip bursitis first. Bursae are small jelly-like sacs that are located throughout the body, including around the shoulder, elbow, hip, knee and hip. They contain a small amount of fluid and are positioned between bone and soft tissue, acting as cushion to help reduce friction.
Bursitis is inflammation of the bursa. There are two major bursae in the hip that typically become irritated and inflamed. One bursa covers the bony point of the hip bone called the greater trochanter. Inflammation of this bursa is called trochanteric bursitis.
Another bursa, the iliopsoas bursa, is located on the inside, groin side of the hip. When this bursa become inflamed, the condition is also sometimes referred to as hip bursitis, but the pain is located in the groin area. This condition is not as common as trochanteric bursitis, but this is treated in a similar manner. Next, I will explain the structure of the lower limb. First, for the hip bone, there is iliac crest, the curved superior border which can be felt along the top of the hip. Anterior superior iliac spine, the prominent from the part of the iliac crest. Anterior inferior iliac spine, located just below the axis. Posterior superior iliac spine, the back part of the iliac crest. Posterior inferior iliac spine, located below the pieces. Iliac fossa, a large, smooth, concave surface on the inner side of the ilium providing space for muscle attachment.
After that, we go to ischium. For the ischium, we have ischial tuberosity, the large, roughened area that bears weight when sitting. It serves as an attachment point for the hamstring muscles. Ischial spine, a pointed projection above the ischial tuberosity that serves as an attachment for ligaments and helps define the boundaries of the pelvic outlet. Lesser sciatic notch, located just below the ischial spine, allows the passage of the nerves and tendons. Greater sciatic notch, the larger notch above the ischial spine, though shared with the ilium, through which the sciatic nerve passes. Ramus of ischium, the thin, elongated part that connects with the inferior ramus of the pubis to form the ischiopubic ramus.
For the last of the hip bone, there is pubis. Pubis have body of pubis, the central part of the pubic bone located near the pubic symphysis and where the left and right pubic bone meet. Pubic symphysis, the cartilaginous joint that connect the two pubic bone at the midline, allowing the slight movement and providing stability to the pelvis. Superior ramus of pubic, the upper branch of the pubic bone that extend toward the acetabulum and contribute to forming part of it. Inferior ramus of pubis, the lower branch that join with the ramus of the ischium to form the ischiopubic ramus. Pubic tubercle, a small bony prominent at the end of the pubic crest, serving as an attachment point for the inguinal ligament.
For the gluteal muscle, we have gluteus maximus. The origin is ilium, sacrum, coccyx, sacrotuberous ligament. For the insertion, gluteal tuberosity of the femur, iliotibial tract of the fascia lata, and the nerve supply is inferior gluteal nerve. Gluteus medius. The origin is ilium between the anterior and posterior gluteal lines, and for the insertion is greater trochanter of the femur. For the nerve supply, superior gluteal nerve. Gluteus minimus. The origin is ilium between the anterior and the inferior gluteal lines. For the insertion, greater trochanter of the femur. For the nerve supply is superior gluteal nerve.
Piriformis. The origin is from anterior surface of sacrum, insertion to greater trochanter of femur. Tensor fascia latae. The origin is from iliac crest and anterior superior iliac spine, insertion to iliotibial tract. Quadratus femoris. The origin is from ischial tuberosity, insertion to intertrochantary crest of femur.
Obturator internus. Origin, pelvic surface of obturator membrane and surrounding bone. Insertion, greater trochanter of femur, medial surface. Superior gemellus. Origin, ischial spine. Insertion, greater trochanter of femur, medial surface. Inferior gemellus. Origin, ischial tuberosity. Insertion, greater trochanter of femur, medial surface. Quadratus. Origin, ischial tuberosity. Insertion, interconcentric crest of femur.
The primary symptom of hip bursitis is pain on the outside of the hip, often radiating down the outer thigh. This pain tends to worsen during activities like running, climbing stairs, or getting out of a car.
Tenderness. The area on the outside of the hip is tender to the touch. Swelling. You may notice swelling around the affected area. Warmth. The affected area may feel warm to the touch.
The other symptom is pain at night. Pain can worsen at night, especially when lying on the affected side. Besides that, pain after inactivity. Pain may also increase after prolonged inactivity, such as sitting for a long time or sleeping.
Factors of the hip bursitis. Weak hip abductors. Weakness in the hip abductor muscles, particularly the gluteus medius, can also contribute to hip bursitis. Bone spurs. Bone spurs or bony growth on the hip can irritate the bursa, can cause the inflammation.
Next is tight muscle. Tight muscles surrounding the hip, such as Tight muscles surrounding the hip, such as the iliotibial band, hip flexor, and hamstring, can put pressure on the bursa. Besides that is overpronation. Overpronation or inward rolling of the foot can increase the angle at the hip and put extra stress on the bursa. The diagnosis that the doctor will perform is a physical exam and needs to ask about the symptom to diagnose the hip bursitis. They may also order imaging tests such as a X-ray and MRI scan to rule out other conditions that can cause similar symptoms.
After that, we will discuss the treatment options for the hip bursitis. First, take a rest. Avoiding activities that cause pain allows the bursa to heal. Ice treatment. Applying ice to the affected area can reduce pain and inflammation.
Treatment of the hip bursitis. Over-the-counter pain relievers, which is non-steroidal anti-inflammatory drugs, or we call it NSAIDs, like ibuprofen or naproxen can help reduce pain and swelling. Next is physical therapy. Physical therapy can help strengthen the hip muscles and improve flexibility and reducing the risk of the future flare-ups. Corticosteroid injections. Injection of corticosteroids into the bursa can provide temporary pain relief. Prevention of the hip bursitis. While hip bursitis cannot always be prevented, You can reduce your risk by avoiding repetitive activities, which is you can limit activities that put stress on your hips. Next, maintaining a healthy weight. Excess weight put excess weight Maintaining a healthy weight. Excess weight puts extra strain on your joints, including your hips.
Next is strengthening hip muscles. Strong hip muscles can help stabilize the joint and reduce the risk of bursitis.
The last prevention is addressing leg length discrepancies. Custom foot orthotic or shoe insert can help alleviate discomfort caused by uneven leg length. If you experience persistent hip pain, it's crucial to seek medical attention to determine the underlying cause and receive appropriate treatment. Early diagnosis and management can help prevent complications and promote a quicker recovery.
Risk factors can include repetitive stress or overuse from activities like running, biking, or stair climbing. They include activity modification, physical therapy with prescribed exercises to stretch out the IT band and increase hip strength and flexibility, or other treatments like foam rolling, ice, or heat. Injection of a corticosteroid may also be helpful in relieving symptoms of hip bursitis. A single treatment may provide temporary or even permanent relief if pain and inflammation return.
Let me stay with you.